Jav, what are the few things that bodybuilders can do if they take steroids and want to stay healthy?
So first thing, check your blood pressure. Very easy to do. You could do that at home. Check it 2 or 3 times a week. Your blood pressure should be in range 120 over 80. If it's a little bit lower, that's fine. If it's higher than that, especially if it gets higher than 140 over 90, that's something that you need to address ASAP. Speak to your doctor about it because blood pressure is a silent killer. Okay, and a lot of people are walking around with high blood pressure and have zero symptoms. I used to measure the blood pressure of hundreds of people when I was a pharmacist, and no one ever complained of a side effect. They'd come in randomly, oh, can you check my blood pressure? I'm feeling fine, but just check it anyway. And it came back high. So that is a silent killer. We need to address that as bodybuilders, especially if you're taking anabolics, because anabolics can raise your blood pressure. And there are drugs out there that you can take, like telmisartan, for instance, that will not interfere with muscle gain, which can help in that department. So that's number one, very important. Number two, check your bloods. You know, do blood tests 2 or 3 times a year at a minimum. That's going to check your liver, your kidney, your thyroid, your full blood count. If your blood's thicker than normal, which steroids can do. So check your cholesterol, which can get raised if you're taking testosterone or other steroids. So blood tests are vital. We look great from the outside, but how are we looking on the inside? And yes, it's expensive. It's around £200 for a blood test. If you're doing that 2 or 3 times a year, it does add up. But if you got money for steroids, you can find the money for blood tests. It's very important. And apart from that, just be a bit more in tune with your body. Are you feeling fine? Are you feeling a little bit off? Is there a niggle somewhere? Is there a pain coming somewhere? When you go to the bathroom, is your piss coming out clear? Or is it coming out orange? Is it coming out cloudy? That's a sign that your body's trying to tell you that something is off. Are you using oral steroids and your piss has changed color? Does it burn when it comes out? These are things that you need to pick up on. Also, your number two, is it coming out normal? Is it not coming out at all? When it comes out, does it really smell really bad? Has it changed color when it comes out? If it's darker than normal, that could be a bit of blood in the stools. So these things, I know they sound gross, but keep an eye on them. So I have a little look when I'm doing a number two, making sure that it's the right color, it's consistent. Yeah, it's gross, but if I could pick up on a warning sign, why not? So just learn to be in tune with your body. But blood pressure and bloods is a must. You have to do that, especially if you're taking anabolic steroids.